Well, welcome everyone to Your Health Partner, brought to you by Lehigh Valley Hospital, Hazleton, and we got some exciting news for you today. Two great doctors are with us, no strangers to this Sam Lassant show and the Health Care Network here. We're going to talk about the robotics, and we have something here in Hazleton that is new, it's innovative, and it's something that will benefit all of us. So let me welcome my good friend Mike Pasquale. Dr. Pasquale, nice to see you again.
Good to see you, Sam.
You were telling me that you've been with the 30-some years, right?
Yeah, I've been with Lehigh Health Network for 32 years.
So you've seen some great things happening in the...
Definitely.
And speaking of great things, let's talk about this merger, okay?
Yeah.
Some people still have an idea, but I'm sure, what's your take on it?
So overall, I think the merger is really going to positively impact the care that we're able to provide. I mean, if you just look at the access now, we have 32 campuses, 700 sites where care is being delivered, and I think it's going to improve the ability for patients to get into us. The other thing is there's more resources. We have more specialists now that folks can see, which is tremendous, and Jefferson has a health plan. So we're going to be able to provide patients with affordable, quality health care with a health plan. So I think overall the impact for the community is just fantastic.
When you're talking about, the specialist, all right, and we said this on a number of shows, when a patient's there, and sometimes they say, well, you better get a second opinion. Some cases, they may not know that there's really more than a second opinion. There's 3 or 4 or 5 opinions because you're dealing with other doctors as well. Am I correct in saying that?
Yeah, definitely. I mean, and again, with this merger, we have more access to more specialists, so that you're right. You could get 5, 10 different opinions within the network, if you like.
Dr. Mahoney, you were with the 10 years, right? I remember when you first came on, you were on the show a couple times. Before we even start talking about what you're here for, I want to personally thank you. I had the endoscopic, right? The receptionist was fantastic. The people that you had up there, I wish I knew their names, but they were all so gracious, and you were fabulous. I mean, bedside manners were great. I'm not saying that because you're sitting here, but compliment. I mean, it was first class. I mean that sincerely, Mike. I'm not kidding.
I believe you.
And it made me feel very comfortable. Of course, I was nervous because, you're getting endoscopic, but thank God everything was good. But I want to thank you for that, okay?
My pleasure.
Okay. Now let's get to work here, okay? That's what you're here for. So tell me about, your part in the network.
So again, I've been with Lehigh Valley for about 10 years now, and been in Hazleton the whole time, and more recently expanded some of my bariatric services up into the Scranton market as well. But that's kind of my role with Lehigh Valley, is just being around for general surgery, being around for bariatric surgery, covering call at the hospital, and just, like he said, providing good quality care for the community. And
when I mentioned about the fact that if they need a second or third opinion, they're there, right? I mean, you conference with other doctors if you have to?
Yeah. In fact, we have a way to communicate directly with other providers, even if they're in a different town like Allentown. We can directly communicate with them. In fact, we do it pretty routinely. It's actually very convenient sometimes.
And Dr. Pasquale, you have some exciting news about the Hazleton area with robotic surgery, right?
Yeah.
Let's talk about that.
So we have a really great partnership with Intuitive, the company that makes the DaVinci robots, and through that partnership, we've really had a long-standing collaboration, and we're very busy. We're probably one of the busiest robotic surgery centers on the East Coast. And that has allowed us to have access to the latest and greatest technology when Intuitive puts out their new platforms, robotic platforms. So we were actually one of 10 hospitals in the country that had access first to the new, what's called the DaVinci 5 platform. The DaVinci 5 platform is different than the other robots in that you can feel tension. Previously, with the previous models, you really couldn't feel tension, so you couldn't feel when you pulled on a tissue. with the new platform, you can actually feel that tension now, and it's better graphics as well. So we were the first to have that, and we recently, through our partnership, have replaced all of our DaVinci platforms with DV5s. So we have that across all of our campuses now, including Hazleton.
So there's always this question about, a robotic versus, physical, all right? What's your take on that?
So that's actually a common thing people ask about when they're coming into the office. And just to reassure everybody, the robot doesn't do anything that we don't tell it to do. It's kind of like a video game. If you don't hold the controller, the person on the screen doesn't do anything. So it's not automated surgery. It's not computerized surgery. It's basically, think of it as a very nice, very advanced tool to help us out. And it actually can make more difficult tasks easier with the amount of technology that goes into it. It just increases a surgeon's dexterity substantially.
But the robot actually eliminates tremor. Everybody has a little bit of a tremor.
Yeah.
Everybody does. But with the robot, it actually eliminates it.
And what surgeries would you do the robotic surgery?
Like what procedures?
Yeah.
So basically anything somebody's ever had done laparoscopically can be done robotically. In fact, I don't even do regular laparoscopy anymore. I personally am strictly robotics with my surgery.
So we're doing robotics in 13 specialties right now. Clearly, the fastest growing over the last 2 years has been general surgery. That's the fastest growing. And people always question, like, well, it's no better than laparoscopic or for as far as outcomes. But I'll tell you right now, I have a hernia. When I have my hernia fixed, I'm having it robotically done. I mean, we've seen the differences that people have with respect to pain, blood loss, getting back to their activities sooner with the robotic technique. So I'm a big proponent.
In terms of the surgeons that you have, I mean, there's so many. Let's talk about the surgeons in the different areas that you have available here in town.
So, I mean, the obviously Mike and his partners, Tony Corrado, Josh Nachemson, and Tokapan. So those guys are all doing general surgery. Josh does some colorectal surgery as well. So he's colorectal trained. And then we have our otolaryngology docs, Drs. Hahn and Pollock. Dr. Hahn actually doing one of the first Inspire procedures.
What's that?
It's a procedure for sleep apnea.
Oh, okay.
People that wear the CPAP mask.
Yeah.
This is a procedure that allows you to get rid of that mask, and it allows people with obstructive sleep apnea to breathe, so they're not waking up at night, and they're not struggling for breath. And Darren was one of the first in the area to use the new Inspire platform.
And what does that do? Like, what is it? A procedure that you?
It's a procedure that's done. It actually they implant a device into your chest, like a little battery. And it's attached to a wire that goes up, and the wire goes up around your hypoglossal nerve. So the tongue is what obstructs, right, when you do this. So what happens is when you're sleeping, when you breathe in, this fires a signal to the nerve, which pushes your tongue forward. So it prevents your tongue from falling back when you're breathing. I mean, when you're sleeping.
Does this hurt?
No, and the new platform cuts the procedure time like in half. It used to take about a little bit over an hour, so they do this now in under a half hour.
You have audiologists too, right?
Correct. Audiologist, that's big for our otolaryngologist, and getting patients access to audiology so they can get hearing aids, and if they need procedures to improve their hearing, it's one of the big kind of barriers that we have now is enough audiology support. So the fact that we have audiology support up in Hazleton is great.
Some of the things that you've seen, Dr. Mahoney, in terms of technology and how it's better for health and for our health.
Like we were talking about earlier, the robotic platforms, even the parts are getting smaller, less bulky, and that also equates to, on the patient end, we now have instruments that used to be larger that are now smaller and more effective. So that's what's making them safer, as well as a faster, less painful recovery.
And I'm sure you've seen a zillion changes, right?
Yeah, I think the big thing is the whole shift that we've seen to less invasive types of procedures. And that really does improve the outcomes because you have less tissue disruption, right? With smaller incisions and things like that. And you know, it's in each specialty we're seeing this where you can minimize the disruption in the tissue. We talked about otolaryngology. Our head and neck surgeons are doing robotic resections of cancers with, you know, less tissue loss for patients, faster recoveries. In urology, prostatectomy, we're doing robotically, and we have a new technology called HIFU. It's high intensity frequency ultrasound that it's a robotic procedure. It actually targets the lesion, so there's less disruption in the prostate. So there's less impotence, less incontinence for patients, which is a huge, huge step ahead.
How do you stay on top of all these things, you know, throughout the years? And
I recruit good people like Dr. Mahoney, okay?
Yeah,
That's what I do.
That's good. But I mean, it's, you know, like, how do you keep ahead of things? You know, is it?
Well, luckily, I think with the training that we get, you get a good foundation, and so when something new comes out, you're just building on that and not relearning a whole new technique. But yeah, usually the improvements are making things easier and more accessible.
I think I asked you when, you know, why you decided to go into medicine. Why did you decide to become a doctor?
It was kind of in the blood. I had, you know, my dad was a doctor, you know, so I watched him growing up and just tried to emulate him, and it was just something I always wanted to do. I don't think I ever wavered away from that. But again, not to sound cliche or hokey, but just helping people out. And in surgery, we get to help them out very quickly and sometimes very substantially in a short amount of time. And that's what's probably the most rewarding part for me.
You have a lot on your plate. But for a doctor, for bedside manners today, you know, and letting the person feel comfortable, that's so important. I mean, you know, it's in Lehigh Valley is, I mean, all the people that work there, I've experienced, even the ER, under pressure, and yet you still have to respond, etc. And I think that comes with compassion, you know, and for that person. I think you have to share that, right, Mike?
You definitely. I mean, we try to, when I meet with our residents, I'll always ask them, they're really good, like, you know, what patient do you have? I got a patient who had gallbladder disease. I go, oh, that's cool. I said, what'd you do? Oh, we did a cholecystectomy. I'm like, that's great. Tell me about it. They tell me about the procedure. I said, patient married? What? I go, where do they live? I don't know. I go, what do they do? I said, these are things you have to know because you have to know the person, not to the disease, because you got to know who's going to take care of this patient when he goes home. You know, how is he going to be able to go back to work? These are important things that you have to know. So I try to tell them, get to know your patients.
I can just tell you this, you know, I've experienced it, my wife, my family, etc., second to none, and you can see why they were voted the #1 surgeons in the area. Come back, we'll talk a little bit more to the good doctors. Stay with us. Welcome back to Your Health Partner, brought to you by Lehigh Valley Hospital Hazleton. I'm Sam Lassant. Joining me today, Doctors Pasquale and Dr. Mahoney. We're talking about, you know, robotic surgery, and now in the orthopedic area, what do we have there?
Yeah, so in our Orthopedic Institute, we have robotic total knee replacement and robotic total hip replacement procedures that are being done. Dr. Favello, well known to the area, doing those cases up at Hazleton.
In bariatrics. Talk about bariatrics.
Bariatrics is a pretty hot field right now for both surgery, and also in the last couple years there's been new medications coming out, the injections that are very popular. So we've seen growth in our program, especially because we've kind of combined forces with the bariatric medicine team, so we're kind of becoming a bigger institute in that regards. But yeah, bariatrics has been a big field.
What's the criteria here?
The criteria to have bariatric surgery is typically based off of a couple of criteria, but the big one is somebody's BMI or body mass index, and that's a calculation based off of somebody's height and weight. That's usually one of the big cutoffs. But we also look to make sure somebody's an acceptable risk for surgery, as well as dedicated to the big change after, because surgery is not a magic cure. It's a change and it's a tool, but somebody needs to be dedicated to the change for it to be successful.
But one other thing that we found with bariatric surgery is that patients with diabetes, it basically can cure their diabetes.
Wow.
Get them off all meds.
Yeah, I'm trying to think of people who are taking the injections now. Okay, that seems to be the big thing now, right? Is now. Tell me about that. Is that how do you view that with the injections? And
I think there's a certain subset of patients that would benefit from the injections. Again, part of the problems with the injections is availability and cost. And then also, too, the weight loss compared to surgery is somewhat modest. So somebody that's extremely overweight may not benefit as much from the shots.
And you have to take it
And you got to take it, yeah.
forever.
is that right?
Yeah.
So is it best to check with your family doctor before you go on these the shots?
Absolutely, because they have to be prescribed in most cases.
A lot of places are restricting them to where you actually have to see somebody in weight management, a physician who does weight management, to get a prescription to get it paid for. The other thing in Pennsylvania is that there's a good likelihood that Medicare is going to stop paying for they're called GLP-1s. They're going to stop paying for them.
Why?
Because it costs a lot of money.
And they take them forever.
It costs a lot of money, yeah.
And why is it they have to take them forever?
Because you're looking for the side effect of the medication, and once you stop it, the side effect is gone.
Yeah. What it does is it slows down the transit of food out of your stomach. So it holds the food in your stomach. So if you stop taking it, so you don't get hungry because your stomach's full. So you're not hungry.
Yeah.
So you don't eat. But if you stop it, then that transit goes back to normal. So you'll be hungry again, and you'll eat.
Wow. So it's best to go to your doctor, get examined, and determine that. Speaking of bariatric surgery, I remember a while back the way they did the surgeries versus today. So you do them robotically, right?
Yes, I do all my primary and revision bariatric surgeries robotically.
I'd love, Tammy, I'd love to be able to do a show, actually showing the surgery if we could get, because we used to do that with Dr. Mead, the show we would on location, it's interesting so people could just get a better feel for it. This robotic thing has me like for years. I was always like, I'm confused about it, and it's great to have, you guys on to explain it to me, The person out there should not worry about robotic surgery.
No, I think like Mike said, the robot is a tool. It's a nicer tool. It's a better tool than the other things that we have. But it's still the surgeon that's performing the surgery.
Well, let's talk about the Jefferson merger. You're talking about the health plan.
Yep.
Okay, how much you know about that health plan? Because people have been asking me, there's a different health plans out there, and they don't know whether they should take the Jefferson plan or not. Yeah.
Yeah, I mean, they should evaluate the Jefferson plan. There's a lot of plans, and different plans are going to work for different people. I can tell you that the Jefferson Health Plan is very good. There's a lot of things that come with the plan that may not be offered by other health plans. So I think it's good for folks to evaluate a number of plans and determine which one's going to work for them. But the Jefferson Healthcare Plan is a very good plan. Mm-hmm. Very
a
good
lot of
plan.
people joining the health
Yes.
plan. Okay. In terms of health care today, that seems to be a major concern across the country with healthcare costs. That always seems to be a major concern. Do you find that, Mike?
I think it's one of the biggest challenges this country faces right now is healthcare costs. The costs continue to rise, and people simply can't meet that with their payment plans. So my fear is that what we're going to end up with is more and more people not having insurance. That's my fear, is they're not going to have insurance, and if they don't have insurance, they're not going to seek care. And I think that's really, really concerning. So, I don't know the answer. I wish I did. I think that we've got to somehow get control of the rising cost and stabilize this so that we can ensure that we do have everybody covered appropriately.
You know, the sad part is you have this great technology that could save thousands and thousands of people, but then you have the area, can I afford to get this great technology?
Right.
Because I don't have the insurance to do that, and here you are, you're in limbo. And that's so sad.
Yeah.
You know, I mean, I wish we had a magic wand for that. You know, because sometimes a person needs a surgery and you're told, well, you don't have insurance to cover that. And that's heartbreaking, you know.
We will take care of patients.
We
will take care of patients. You know, and we will work with them on their payments or whatever we need to do, because we want people getting the right care. And my fear is there are a lot of people that don't even look for care because they're worried about the payments.
Yeah. Well, all I can say is that, you know, I've been doing this show a long time, as you know, and I always, I learned so many things. And, you know, when you're looking at behind the scenes, what, you know, you doctors do, and all the nurses and the LPNs and everybody, like I said, your staff, you know, was second to none, really, Mike, I'm telling you. I feel good about it. You know, I would never do it. You know, they say, why do you do the show? Well, yes, the show is sponsored, but I wouldn't do it if I didn't believe in you guys, you know. And I think the Lehigh Valley Health Network system is absolutely second to none, you know. You can't, especially with this merger. When people appreciate what the merger is all about, it's great, you know. Nice seeing you.
Nice seeing you.
Okay.
Hope you have a great holiday season.
It's your health partner, my friends. The number's on the screen if you have any questions. It's give them a call if you have any questions about it. But this great technology that they have is good for all of us. We'll see you next time.